Welcome to Sheboygan County Government, working for you. My name's Adam Payne, County Administrator and co-host of this program with Chairman Roger Destrudy. As you know, every month we strive to bring a different department, program, focus for our viewers so you can learn a little more about the roles and responsibilities of county government. It's really an exciting week. This is PGA week for Sheboygan County, so maybe our viewership might be down just a little bit. Then again, I think this is a tape-delayed program, so hopefully not. But I imagine some of our viewers have had a chance to go out and check out the PGA grounds, Whistling Straits, one of the most beautiful areas in Sheboygan County, and certainly one of the most beautiful golf courses in the world. And just before we started taping the program here, my fearless leader, Roger Destrudy, shared with me that him and his grandson were out there. And hey, Matt, why don't you come over here for a second? You're probably going to have to get in here pretty close or stand next to your grandpa. Why don't you stand next to your grandpa here? Now, Matt, I understand, is 10 years old and Chairman Destrudy's oldest grandson. Is that right, Roger?
Yes. Yep.
And you guys went out to the PGA today. Mm-hmm. How'd you like it, Matt?
It was cool.
Pretty cool? Mm-hmm. You went around, saw some of the golfers? Mm-hmm. Very neat. So just grandpa and grandson walking Whistling Straits. Have you ever done anything like that before?
No.
What was the neatest thing about it?
The whole course.
Yeah. You're going to be a golfer someday?
Sure.
But you were telling me off the air you'd prefer to be a quarterback. Is that right? Mm-hmm. Yeah. Well, Matt, it's good to meet you. I know Roger thinks the world of his family, and it's nice that the two of you could spend the morning together. So thanks for joining us for a couple minutes. Mm-hmm. You can go back to your chair now and critique.
Thanks, buddy.
Pretty nice to have him along with you today.
Yeah, we had a great time out there.
Well, working with families, working with children, adults, all walks of life, that's what the Health and Human Services Department does. And today we're so pleased to have Tom Eggebrecht with us, our Health and Human Services Director. Welcome, Tom.
Thanks, Adam. Nice to be here.
Please begin by setting the stage for us a little bit. Tell us a little bit about the big picture roles and responsibilities of your department. It's the largest department in Sheboygan County government at about, I think, $31 million a year.
Yeah, we're just over that now, Adam. And actually, Health and Human Services in Sheboygan County, like all counties across the state, is a state-mandated provision of service. So statutes require that counties, and specifically county boards, are responsible for assuring the provision of specific services. So that includes protective services, health-related services, economic support services. So that's the work we do under our Health and Human Services umbrella. We're located in 4 different spots. So our main building downtown across from Fountain Park offers child protection, juvenile justice, behavioral health, and public health services. Our ADRC in Sheboygan Falls offers information and assistance to folks who qualify for long-term care benefits, and also our aging programs, which include senior meals and other like services. In our job center, the Sheboygan Job Center on Wilgus Avenue, we have our Economic Support Service Division, and just this year we added child support services under our Health and Human Services umbrella, and that staff works in the courthouse annex right in Sheboygan. So all those services I just described, 4 separate locations, 4 separate staffs.
Yeah, you summarized that about as concisely as I've ever heard anyone do so for our Health and Human Services Department. A little over $131 million budget, as you said. How many staff work for the department?
Actually, $32 million budget, not $132.
Oh, yes.
We're not there
I
yet.
just gave you another $100 million.
Well, thank you. And it is. I'm glad it's budget time.
Thank you for catching me.
So
Yeah.
I think we'll
A little over a $31 million
Okay, we'll do
budget.
fine with that adjustment. I'm sorry. Your question was what?
How many staff work for the department?
Yeah, so yeah, you're right. Our budget is in the range of about $32 million. We had, with the addition of child support this year, we'd been operating for the last several years with just under 180 staff, 179 or so. With the addition of those 12 staff this year, we're at 189 currently. So just under 190 staff in total, 4 separate locations.
And staff that are providing just critical safety net services to people in need in this community. And we were talking a little bit off the air. We're in the midst of our annual budget development process, and always one of the more interesting reviews for me, you know, we have 19 departments, is the Health and Human Services Department budget, because of the incredible scope of programs and services that you provide, you know, to children, to aging people, people with disabilities, people with economic needs. I mean, the list goes on and on.
Mm-hmm.
And I think at one point you or maybe your predecessor shared with me, I mean, you're literally touching thousands of lives throughout Sheboygan County, whether it's individuals or the entire family, correct?
Mm-hmm.
What do you see as some of the key, you know, for our viewers, you know, what would be an example of a program that deals with children, for example? We just met Matt, who obviously comes from a good home and, you know, has clothes on his back and is getting the upbringing and needs that a young person requires. But you are working with some children that don't come from families that have either the finances or other things going on. What are some examples?
Well, again, I think none of us is immune from challenge at any point in time. And so when families are intact and income is sufficient and health is protected, things are extremely good. But as you point out, that's not always the case. I think that sometimes economic sufficiency is a problem. And when you don't have economic resources to take care of the things that need to be taken care of, that always places stress on families. With stress comes emotional challenge, sometimes breakdown. With stress comes substance use and at times abuse. And so when you get into those cycles, I think that any of those combinations, whether it is a child dealing with the emotional stress of school or life adjustment, or if it's parental issues, and we're seeing a great spike in terms of drug use and abuse and the heroin problem, things of that nature. So really, the work that we do falls under a category of safety net. And so I'm reluctant to say that when families are doing well, I would love to be more involved with them. Yeah. But also, I think there's a philosophical basis there that says government shouldn't really be in the lives of people who are doing well, and we try not to do that. But when anyone who's vulnerable, anyone who's in a difficult spot, and it rises to a level of concern, hits our radar, that's when we do need to be involved. So that might be through child protection. That might be through juvenile justice if a young person has committed crimes against community or others. That might be in the arena of behavioral health when a child has emotional adjustment issues and sometimes might need to be hospitalized. That might be in the form of our economic support assistance to assure that necessary, at least base resources are provided, or that could be as simple as nutritional assistance or immunizations that are provided by our public health division. So a child or family could be involved at any level in those services, sometimes in many levels at the same time.
I think the area that's always really pulled at my heartstrings, and I think many people can relate to that, is when you're dealing with child neglect or child abuse. And I'm just so thankful we have people on staff who can respond to those types of situations. Is that generally something where a neighbor will inform the department of something they think is going on with another neighbor, or it might be the school? How do you get those types of referrals so you can intervene and help that family and most importantly, help that child?
Yeah, those referrals come from multiple sources, as you mentioned. Schools are obviously a large source of referrals. It could be a neighbor, as you described. Physicians oftentimes will be involved in those referrals. Sometimes families themselves, you know, and I think that's a difficult spot for families to be in. But if you see that your sister-in-law or brother-in-law is behaving in a way that doesn't seem in the best interests of a child, yeah, absolutely, we get those calls. So the protocol then, and the community needs to understand, we operate under standards that are passed to us by state and federal governments. There's risk that's assessed. And I think there's times that people get hopeful that they'll make a referral on the basis of a diet that a child might be receiving. And quite honestly, under those standards, a poor diet in and of itself is not cause for intervention. Conversely, if that diet is resulting in health-related issues, and that can be proven in a court, that would be cause for intervention. So all of those calls that you're describing are screened. So we have staff that take that information, that gets handed off to a supervisor who makes a screening decision, and screenings can result then in further investigation. Investigation can result in substantiation. Once we have substantiation, then we open up those intervention relationships on a non-negotiable basis. At that point, we have to become involved. So when I said earlier it'd be nice to be involved, a bit before that, or with a bit more proactively, that would be ideal. It is essential that we're involved at the level that we are.
Your department became even more diverse the past year because we used to have 20 departments. Now we have 19 in the county because we merged the Child Support Agency or Department with the Health and Human Services Department. And I appreciate your leadership and your management team for being able to incorporate that. As you know, we've gained some efficiencies and better communications. This isn't a situation where child support is dealing with abuse. This is a situation where, unfortunately, many people get divorced and funds need to be provided to help support the children. How did that merger go?
Yeah, you're right. So child support is by mission, established out there to assure that responsible parents contribute toward the financial and health well-being of their children and families. Our Economic Support Division is charged with the responsibility of assuring that resources are made available to families. So by mission, child support seeks parental involvement in that, and by mission, we assure that sufficient resources are made available. So taking a look at that, there was close alignment between the two missions, and so when the request was made for us to consider integrating that operation within our department, by purpose, by mission, I think that was a great fit. And I would also say, Adam, that you made reference to our management team. Kathy Pluscott is our child support supervisor. Tim Gessler is our economic support manager. And given the close alignment between those two purposes or missions, it made sense to try to incorporate that under our Division of Economic Support Services. Between Tim's leadership, Kathy's support, and I would say the good grace of all the staff involved, it has been a seamless, and to my view, largely painless merger, and it's gone well. We're glad to have those staff in the department. I've enjoyed getting to know each of them a small amount, and certainly more in the years to come. But
I think it's
gone
been
well.
as seamless as any consolidation we've had, and we've had a number of them the last decade, but I haven't received one complaint. It's been very, very well managed, and I appreciate that. And earlier I said child support for example, in situations where there's divorce, but as you said, it's not just that, it's parental responsibility. You'll have situations where a child's born and the parents may never get married, but certainly adequate economic support needs to be provided to take care of that child.
Yeah.
So it's a tough job.
It is a tough job. I mean, that work involves locating responsible parents, sometimes establishing paternity, sometimes pursuing collection action. And that's all done in close alignment with corporation counsel, law enforcement, and the courts. So yes, it's a tough job.
Last question before I turn it over to Roger. And you mentioned very briefly where your location is there across from the Fountain Park, downtown Sheboygan, a beautiful area and beautiful addition. Last time we were together, you were in the midst of the remodeling and adding on and making some nice improvements to the Health and Human Services Department. That remodeling is now complete, and what's your assessment? How has it played out for staff and most importantly the customers we serve?
Well, you're right. I mean, I'm so pleased, and I appreciate, your support, the county board's support, our committee's support in making that possible. How has it played out? I would say that we're probably 98% completed. We have some small tweaks left to consider. We've got some, not related to the addition, but we've got some internal remodeling that still needs to be done. We want to resurface and repaint the parking lot to improve the traffic flow, improve safety through there. But to the outward eye and to visitors, it has been such a great supplement to the work that we're doing. So we have a new improved lobby. We have new offices for our health service providers, our doctors and nurses. We have a great conference room upstairs. And most of all, we have some green space outside. So you're talking about Whistling Straits, it's a big deal for me. We have patch of lawn outside and, you know, some flower gardens and some trees, and it's really about trying to create a welcoming environment. And I'll tell you what, there's been adjustments for our staff. So we went from a setup where all staff and visitors were entering and exiting through our main lobby to a process where we now have central reception and employee entrances. So we're reserving that lobby and waiting room for visitors alone, in part to protect their privacy and be respectful to them, but also to promote better security for the building overall. So for our staff, I'm going to be honest and tell you, it's been an adjustment. They don't like not being able to come through the lobby. They don't like not being able to enjoy that nice new environment. But for visitors, Adam, I can't tell you how many positive comments I've received. And even that conference room, we think that's a gem and available to the community as much as it is our department. So earlier this spring, as an example, we had 120 officers from the Sheboygan Police Department, Sheboygan County Sheriff's Department, using that facility for 3 solid weeks of training on crisis intervention. So it's been a great, great asset, great value added, and I think it's going to provide that for years to come.
Outstanding. I've heard a lot of compliments from people in the public as well, that it's just a beautiful addition. Nice work.
Thanks.
Tom, it's great to see the new addition and some of the things that are happening, but you also have some major initiatives going on and some other changes. You want to describe some of the major ones to us?
Sure. So, I mean, related to that lobby, Roger, one of the things that was important to me in this current year is to do something about better provision of information and assistance, not only for people needing services from our department, but people needing services across the community. So at the beginning of 2014, there was a community conversation on mental health. And one of the things that those 300 stakeholders who gathered for that meeting identified was the difficulty there is in navigating services. There's a lot of services out there, but they all have specific rules and populations, and unless you're well versed with them, it's extremely difficult to navigate through that maze, whether you're a consumer or a professional. So this year we established 2 positions dedicated to providing assistance to walk-in visitors, callers, and community at large to help with that navigational assistance. So we just got that up and running 2 months ago, and so it's in its infancy, but that's going very well. We're in the process of trying to pilot some opiate and heroin detox services. One of the things that we know about heroin detox and the heroin problem in the community is that medical detoxification is not likely to occur. It has to happen outside of a hospital setting because it doesn't rise to a level of medical need. So we're piloting efforts in that area, and we've also been pretty involved in trying to get a drug treatment court established right here in the county as well. They're taking a good amount of our time.
Well, why don't you describe that drug treatment court and how does it differ from the other court, and how are you hoping it to improve the situation for the people?
Sure. Drug treatment courts have been on the landscape, I would say, for a little over 2 decades now. Started in Miami, Florida, a little over 20 years ago. There's close to 3,000 that have been established nationally now. A typical court would establish innocence or guilt and then hand out punishment in relationship to a crime. With a growing prevalence of drug-related crimes that are out there, a drug treatment court offers select participants an opportunity for treatment as well as accountability. So the concept is you have a lead judge that takes ownership of that court, who works with a team of professionals, including treatment providers, and for persons enrolled in that process, they can accept treatment in lieu of incarceration, and when they achieve their treatment goals, they're subject to reward. If they fail to meet those goals, they risk incarceration. And what the research has shown is that in terms of justice interventions, that's a highly effective one and a very cost-effective one. So what we find is that participants tend to end up clean and sober. They tend to reunify with families, and family functioning is improved, and repeat crime is reduced. So again, in terms of interventions, it makes a great impact, and it makes a lot of sense for us to pursue.
And like many other communities, sadly, our community has issues with some heroin use. How does that impact your Health and Human Services?
Sure. What we know is that heroin use has really spiked in recent years. So I grew up thinking heroin was a problem in major cities and dark alleys and a byproduct of poverty, and it's not so much that today. Use has exploded in recent years. We know that heroin-related crimes have doubled in the last 2 years, between 2012 and 2014. And it also concerns me that Sheboygan County is in the top tier of counties where heroin-related crimes are most prevalent. So our contiguous counties don't fall in that category. We're now in a grouping that goes with Milwaukee County and Rock County and Dane County. And so that's not a distinction that we feel good about, and it's something we need to respond to. In terms of how that plays itself out in the course of our department, we see a lot of drug-addicted parents. We are now beginning to see drug-addicted infants who are addicted to opiates at birth and who need to be detoxed themselves. We have a spike in foster care related to children who are going through withdrawal and trying to reunify them with parents who themselves yet aren't clean and perhaps aren't prepared or willing to seek treatment. So it compounds itself. I think I've seen data that says about half of all major crimes are related to drug use, and about half of all suspects in violent crimes are deemed to be under the influence of opiates when those crimes occur. So it's a community problem, it's a department problem, and as I said earlier, it doesn't know any social or economic boundaries. Actually, Representative John Nygren from the northern part of the state tells a very compelling story about his family struggle and his daughter's addiction with heroin. So if it can happen to him, it's out there and can happen to any family. So it's a major problem.
And what other entities are you working with to raise the awareness of the problem and try to seek solutions?
We've got great partnerships. I mentioned earlier that if we're going to establish a drug treatment court, it has to be under the leadership of a judge. And recently retired Judge Burke has stepped forward to volunteer to be the lead judge in that effort. So we've worked closely with him. We have the support of the county's Criminal Justice Advisory Committee in that pursuit. District Attorney Joe DiCecco is on board with us. Chris Petros from the Public Defender's Office has been a great contributor. Chief Domagulski and Captain Jim Vieser from the Sheboygan Police Department have been at the table and are strong proponents. Family Resource Center in Plymouth has been at the table. And our Public Health Division's Healthy Sheboygan County 2020 initiative, which is a partnership between our department, United Way, local hospitals, and others, is fully on board and contributing to that effort as well. So it's a community-wide initiative. It's not our department alone, and we're happy to be part of it.
Well, thank you very much, Tom, for your great leadership and for all the good work your staff does for the citizens of Sheboygan County.
Thanks, Roger.
Earlier, we talked a little bit about it's that time of year where we're developing the annual budget and meeting with all the department heads and reviewing the budgets. And as you know, we essentially have a new norm. We've been living under state-imposed levy limits or caps for a number of years now. Initially, when they were put in 8-10 years ago, the county board was already going down a path of trying to help the community by reducing property taxes because of the recession, what have you. Now we're at a point where costs are escalating, whether it's transportation or addressing needs such as heroin abuse or creating a drug treatment court. That takes money, it takes resources. How do you develop a budget with these limited resources and address growing needs in a community such as drug abuse?
This sounds corny, but I just want to say how blessed I feel to have the staff that we have working for us. One of the things that we have done in recent years, Adam, is try to push awareness and decision-making down, not from an administrative level, but push that as low as we can in the organization to raise awareness about the cost of services, to increase awareness of how effective services might be, and to empower staff to make good decisions about what services they might consider or might pursue. So we try to involve, and it's still a work in progress, but we try to push that down and involve all levels of staff in that decision making. Number two, I would say that our staff is really inclined toward being frugal, being efficient in the work that's being done. And you know, we've actually realized some healthy positive budget variances in recent years, and that's a byproduct of staff's efforts to try to contain cost and minimize exposure to financial risk. The third thing that's in play is that we're again blessed to have the opportunity to be creative and to pursue new sources of revenue in lieu of those general state aids. So the most recent example I can give you, in the last state budget, the governor opened the door to some state aids that would be made available to counties willing to partner with other counties in the provision of specific mental health services. So our staff took that on and partnered with Washington, Ozaukee, and Dodge counties, and as a byproduct of that partnership, our current projection for the next year will see in excess of $600,000 additional dollars coming into our system as a byproduct of trying to develop a regional approach. So we have the opportunity to pursue those things when they come up. We've been blessed thus far, and so through that combination of factors, I think we've been able to do well, and a lot of that credit goes to our staff.
Yeah, I hear you loud and clear. I'm so proud of our team as a whole. We've got a strong management team. We've got strong staff throughout, and it's been rather remarkable, the track record we have at the county, where even with these state-imposed caps, we've been able to reprioritize, gain efficiencies, consolidate, as we talked about earlier. I mean, no stone has gone unturned to hold the line on property taxes or work with minimal increases. Though at some point, as the three of us know and our county board knows, for example, transportation costs, staff can get creative, but it still takes resources, and oil and gas and other costs are going up, so our challenges still continue. But Tom, I want to thank you for a great brief overview of the Health and Human Services Department's roles and responsibilities. If there was something you were hoping Tom was going to talk about today, or you have a question for Tom or a member of his team, don't hesitate to reach out. We appreciate suggestions for improvement, and we certainly appreciate your questions or concerns, things that our department can help with. So Tom, again, thank you for joining us today.
Thanks, Adam, for your time and your support.
We've got 25 county board supervisors representing you across the county, and as you know, you can reach out to any of them at any time as well. If you're not sure where to go or who can help you, certainly reach out to your county board supervisor. Next month, we're going to have a new department head here, Wendy Sharnan. She is our new finance director and has only been on staff now for a couple of months, but she's been heavy into the budget development process, and you'll get a chance to meet her and hear about some of the challenges we have with our budget development process as a whole. But until then, on behalf of Roger Destrudy and his grandson Matt, and myself, Adam, as your county administrator, thank you for joining us, and we'll see you next month.